I contacted both last night and this morning, both the White House as well as the Vice President's office. They were deeply saddened and concerned about it and wanted to make sure that I conveyed their concern, but also their commitment to provide support to help Arlington and Tarrant County and the state of Texas be able to respond to this tragedy. In doing so, I also talked with all of the top federal health officials who are in charge of the COVID-19 response. I talked to Dr. Kadlik of the Federal Health and Human Services. He is basically in charge of the emergency response to COVID-19. I talked to Dr. Giroux, who is the doctor in charge of the federal healthcare providers. I talked to both CDC officials as well as officials who have been involved in the response to a situation that took place in Washington State, which some people may draw as parallels, but it's really different than what has happened here in Arlington. All of these federal officials offered their full support as well as resources. And they outlined for me what needed to be done and the resources that are needed to respond to what happened at the Masonic Retirement Center. They include the strategies of testing every single person that Patrick James, his wife, have had any contact with in any recent time period. That would include everybody at the Masonic Retirement Center. Whether or not they had contact with him or not, their recommendation was to test every single person at that retirement center, as well as the healthcare providers and anybody else who may have come into any type of contact with Patrick James. They talked about the necessity of having a CDC epidemiological team be involved in this process because of the size of the operation. There is one of those teams en route as we speak. They talked about the need to increase and improve the infection control procedures at the Masonic Retirement Center. The retirement center is not the type of location that typically would have these infection control procedures in place before something like this would happen. But in the aftermath of something like this, not knowing who in that center may be exposed to COVID-19, it is essential that those infection control procedures be put into place immediately. Similarly, there must be a limitation on visitors. Now, this is something that was contained in my disaster declaration last Friday that should already be in place in facilities like this retirement center. But we do want to emphasize the mandate limiting visitors into this retirement center because you're walking into a zone that could include people who could test positive for COVID-19. Along those same lines is important, according to the CDC, to limit movement within this facility again, because until we test everybody in this facility, no one knows who may or may not have exposure to COVID-19. And then, of course, they talked about conducting a full trace of all movement of anybody who either had any type of contact with Patrick James, with his wife, with anybody who could have any type of exposure to COVID-19, and make sure those people get tested. They understood the necessity that Arlington and Tarrant County have more testing capability. I asked them to send it immediately. When I arrived in Arlington today, we had already received 2,500 test kits to assist in this process. When we arrived in Arlington today, we had already received these, which are the test collection kits, where the biological material is collected from the person who We'll use this material to then run the official test to make the determination whether or not COVID-19 does exist in a particular person. I had the opportunity to speak last night with Judge Whitley as well as Mayor Williams. And first of all, I applaud their swift and quick, decisive leadership and engagement in this. They're doing all the right things to help respond to a situation like this. Also thank their first responders, all the healthcare workers on the front line who've been involved in responding to this, who in a way heroically have put their lives on the line in trying to help those who may be exposed to COVID-19. I made clear to them last night what I have reiterated today and will be insistent upon going forward. And that is the state will partner with them and collaborate with them at the local level to the fullest extent possible. We will provide whatever type of support, whatever type of resources, whatever type of equipment, everything they need to make sure they are fully able to respond to and contain any type of exposure in this particular situation. All of us share the very same goal. We want to limit the spread of COVID-19 to other residents, and we want to limit the spread by anyone and to anyone that could be affected in this particular incident. Now, the fact of the matter is, when you consider what happened here, we must understand that Texas and Texans are living in challenging times, but Texans are always up to those challenges. We've dealt with SARS, we've dealt with H1N1, we've dealt with Ebola. We will get through this just like we got through those other infectious diseases. The family affected by this, the city of Arlington, Tarrant County, and the state of Texas, we all need to support each other. We need to show patience. We need to show collaboration of everybody in the entire community to ensure that we resolve this situation with the maximum public safety.